So thank you all for being here tonight. I'm excited to be giving this presentation. And, I want to start off by saying exercise should be easy. And it's not the effort that goes into exercising or trying to fit time in your schedule, the exertion, all of that. That's a different thing. What I'm talking about is we don't have to make it complicated. And, with my background, my undergraduate, my graduate education, the shirt that I'm wearing says strength and conditioning, and that's largely what has shaped the practitioner that I am now is that field of working with elite athletes. And, it's really easy to make things complicated really quickly. And I'm actually going to show you an example of how we can complicate things. Please don't try to read any of this. This is, the print's really small. This is all just to illustrate a point. And this is an annual training plan. This is me. This was a goal that I sought out to again when I was starting educating myself as an undergraduate, a volunteer assistant coach, a graduate assistant, then finally getting hired on into a position. And as I learned more, I wanted to create this, grand plan for these teams that I worked with. And this is an example of one of the college teams that I worked with. And I wrote this actually in a ballroom in a Las Vegas hotel during our conference championships. This isn't for the current season we were on. Our season was about to finish. This was for the next season. As you can see here, this is a 43-week plan. I was sitting there just working away, trying to think about all different phases of training. You all see all the color coding in there. I was thinking about what time the athletes had their classes, how many hours a week I'm going to be able to work with them, their practice schedule, all of these things. And not for the sake of making it complicated. Of course, we don't want to think of all these variables intentionally to make things just difficult for the sake of being difficult, but I wanted to be extremely detailed and get everything to the finest details. And it took time over years to really realize, and obviously say like the Golden State Warriors came to me and was like, hey, Matt, you want to be our strength coach? I'd be, yeah. And I'd present something just like this. But what I learned over the years of working in strength and conditioning, now working in cardiac rehab, is we don't have to make the exercise portion complicated. We need to make it effective, of course, and hopefully by the end of this presentation, we'll all have a good understanding of what those building blocks of a successful exercise program is. But I just want you all to kind of take a step back, take a breath, and just know as long as we're meeting these basic requirements, we're training smart, we're not injuring ourselves, we're doing the right things. And I'm going to, move on to this next slide, come back here so it's a little less visually stimulating. But a big role that I had in strength and conditioning was the return to play protocols. And this is an athlete that's injured, they can't participate, and it's my job to get them back from that point to their field of play, working with surgeons, physical therapists, athletic trainers, and the actual sport coach to get that athlete from one point to that final point where they're actually competing again. And this became an extremely interesting process to me. Obviously, never wanted to see an athlete get hurt, but interesting in the sense of how we address the rehab and get them better. A very common injury, say the ACL. No one athlete is going to go through that process the same way. Some athletes that I dealt with would develop a cyclops lesion deep into the kneecap, so where the surgeon would have to go in, do another operation to break up that fascial adhesion. So then we'd have to restart that process over and make sure we can get full extension in the knee. That's just one example of all the different things we have to think about. But within that process, it's realizing that every athlete is going to be a little different, regardless of the mechanism of the injury, the type of injury. And I've really been able to carry that over into cardiac rehab. No stent patient, no heart attack patient, no heart failure patient, even though they all fall within similar parameters, given, the procedure they were under, the complications that they have, and we're going to treat them the same way in certain senses, but everybody's an individual, and I need to treat that person and get them better as soon as possible. And that's something, a mentality Dr. Nishtala and I share. We want to treat our patients as athletes, and that's not to have unfair expectations or unnecessary expectations on performance. Like, we don't need a rehab patient dunking a basketball, running up and down a court, doing whatever high intensity type exertion, unless they want to. And by all means, if you do, please ask. I'm more than happy to get you there. But the commonality that I see is, or the difference is, I should say, it's outcome expectation and timeline. And the outcome expectation being, we don't need an athlete again to perform these high level feats, but we want them to get better. And we want them to do it in a timely manner. We don't need to be in a hurry. We need to make sure all of our T's are crossed, our I's are dotted, and we're doing all of the right things. So kind of with that being said, laying the foundation for this, I want you to take what may be an inaccessible idea for some of you. Maybe exercise is new. Maybe it's something that you have a lifetime of experience with, and take some of the pressure off. So with that being said, I'm going to get into the objectives of this presentation. I'm going to start off by talking about the pillars of exercise and the basic foundations a good exercise program is built on. After that, I'm going to go over basic recommendations. And I want this, I want you to take away a lot from this presentation, but this is one where we get asked a lot, like, how much should I be doing? What should I be doing? That slide is going to take care of a lot of that. After that, I'm going to go over the benefits and the physiology of exercise, so we have a good understanding. It's not going to be very in depth. A lot of these topics could be an hour-long presentation in and of themselves, but I'm going to go over how exercise affects the cardiovascular, the musculoskeletal, your metabolism, and also cognitive function. At that point, we're going to shift over and actually move into the applications of exercise. We use the FIT principle, in cardiac rehab specifically, also similarly in sport performance. And this is looking at the frequency of training, the intensity, the time, and the type of training that you're doing. Additionally, I want to cover motivation and community. Sometimes things get hard. You're trying to find a reason why you're exerting yourself. You're tired, you're not feeling well, you're not interested in exercise, but finding the drive to do this, a reason why, and finding community to surround yourself with so you feel supported through this process. And finally, I want to go over how we at Marin Health provide exercise to our rehab patients. Okay. So now, jumping into the pillars of exercise. Some of these will have two meanings, and I'm going to go through this list. It's a list of three. The third pillar is actually going to be kind of split into two, so kind of four pillars in here, but I'll go over that. First, we're talking about strength. And I think the first thought a lot of people will have is that physical definition of being strong, being able to exert force on an object, move your body through space, pick things up. Pretty obvious there. We want to develop that with exercise. But also emotional strength, the resolve. Some of the people in here, I think a lot of the people in here have overcome some sort of cardiovascular procedure, some cardiovascular event, and you might feel at the lowest point you've been. You're challenged, but having that ability to push yourself when things get hard is another important aspect of exercising, building that pillar of overall strength. Second, we want to talk about stability. First, we don't want to fall down. We want to be able to control our bodies through space, standing on one leg, moving around, rotating, twisting, pretty self-explanatory. But also we want to have balance in our overall health. Health isn't driven off of one of these elements. We have, our diet, we have exercise, we have sleep, substance abuse, all of those things. And, kinesiology is a study of human movement and how the body interacts with exercise, but it's an interdisciplinary study. It's not just the physiology or the biological science, but it's also the combination of sociology, psychology, diet, all of those things, and making sure we have a nice, stable approach to our health and exercise to make sure we're actually benefiting ourselves to the best we can. Now, fitness. This is the one where it splits into two, but generally fitness is talking about your ability to do things, getting the job done, and having the energy, the prerequisite fitness to complete the tasks you want to do, whether that's hiking, your other activities of daily living, moving stuff around, going shopping, being independent, because all that's going to allow you to do is enjoy your life more. If you start losing out on these activities, things are starting to get a little bit harder. Things maybe 6 months, a year, 2 years ago that you had the ability to do, maybe those are starting to kind of slip away from you. So making sure we have a good established base of fitness is important to maintain as one of these pillars of exercise. And as that splits up, we want to talk about aerobic and anaerobic capacity. And as it relates to fitness, your aerobic capacity, if you will, think about it as your gas tank. The better your aerobic fitness, the larger that gas tank is, the more energy you'll overall have to complete these tasks. Anaerobic's a little bit on the other side. This is that jet fuel you're getting. You need to do something fast, a sprint, a jump, move something heavy. Having a balance of these two types of fitness is also crucial for making sure, again, we're addressing all of these pillars effectively. Now, in this chart on the right side, we talk about the sickness, wellness, fitness continuum. And, it's based on these measurements here, as you can see. Don't worry about reading those, but it's your normal health risk factors. Maybe that cardiac event that you had gone through, maybe you've been sick, you've been injured, you find yourself on this side of the spectrum. Over time, you start introducing exercise, you make better life decisions, you start moving into this wellness category. And people can live there just fine. This isn't, getting to fitness is the optimal goal. It's perfect. It doesn't have to be that. But when we talk about wellness here, it's balancing all of these different risk factors. And then pushing fitness is introducing more exercise. You have a specific goal. And what this continuum doesn't do is actually show that fitness can circle back all the way to sickness. You want to think about extreme cases of ultra marathon runners, maybe football players, people at the peak of their sport. Well, when they get injured or they do too much, well, they find themselves all the way back on this sickness side. So it's all about finding that balance where you want to be on this continuum. Now, talk about the basic recommendations. I wanted this to be very straightforward. And again, this is one of the many points I want you to take home, but this is very important because we get asked this all the time, like, how much should I be doing when a patient's leaving our programs? Well, this is from the American College of Sports Medicine and the CDC, and these are basic minimal recommendations of 150 minutes of aerobic type exercise and strength exercise or that anaerobic side 2 times a week. Again, these are minimums. As you can see on this side, how you break it up is really up to you and your schedule. And you're not stuck all with one way. You can do 3 sessions a week that last about 50 minutes of that aerobic exercise. You can break it all the way up into 10 sessions that are 15 minutes each. Again, there isn't a right way to do this, and you might change week to week depending on work schedule, availability of the type of exercise you like doing. Like if you like going outside on walks, it's been really rainy recently, it's been cold. Maybe you're not able to do those as frequent sessions, or maybe you can only make it out in between these rain bursts that we have. There is some research to say, to demonstrate there might be a benefit of higher frequency training being more effective than the less frequent longer sessions. And that's going to really be related to breaking up sedentary time. If you find yourself seated a lot or in a job where you can't move around, or maybe you have one really big session one day out of the week where you train for 3 hours, but then you're sedentary for the other 6 days of the week, there seems to be a positive relationship to training more frequently. But again, as long as you're meeting these minimum requirements and going beyond if you can, you're doing most of that work. So again, you will have access to a recording of this. You'll have access to the slides. So this will be available to you. Okay. Now, moving on to the benefits of exercise, and really we want to know, why should we exercise? We're told it's good for us, but really, what is the point? I'm going to start on this left side here and then move over to this graph. But it's improvements to your cognitive health, how your brain is functioning. You're improving your cardiovascular efficiency, how your heart, your blood vessels all work together. You're maintaining or increasing bone and muscle mass, which is incredibly important for maintaining activity throughout a lifespan, and also improvements in digestion and your ability to use fuel and get it to where it needs to go. And this can be broken up into immediate benefits and also long-term benefits. When we see the immediate benefits, we talk about sleep first. And maybe exercise is new to you. You start doing it and you're just wiped out. You're tired, your head hits the pillow, you're falling asleep, you're sleeping all the way through the night. That could be an immediate benefit for you. Also, less anxiety. Maybe you have a lot of stress at work, a lot of stress in your life. And this is anecdotal, it's personal experience, but coaches in the field I have heard share this kind of sentiment of maybe you're doing that aerobic type exercise, you're going out for longer periods of time, or even just out on a walk. You're able to actually process some of these emotions, some of these stresses, and maybe it gets pushed to that subconscious where your mind is distracted by something else and you're actually working out these problems. On the other side, maybe you're doing a really high intense exercise. You're at a boxing gym punching a heavy bag, and you're letting out this frustration and this anger. In a similar way, you're working through those emotions, maybe over time feeling a little less anxious. And also we see immediate reductions in blood pressure. When you exercise, more blood is flowing through the vessels. And when you stop, the vessels stay dilated for a period of time. So when you're actually at rest, and a lot of you that have been in our program will notice your resting blood pressures at the end of exercise being lower than when you started. And that's for this exact reason of the increased blood flow. We talk about the long-term changes. We see improvements in brain health, and I'll go over this a little bit later into a little more specifics. Your heart health is improving. You're improving your ability to fight off cancers and other inflammatory markers. You're maintaining a healthy weight by being more active, obviously maintaining energy balance or in a slight deficit if your goal is to lose weight. You're stimulating bone and muscle strength, and also working on that balance and coordination, which very much relates to your overall brain health. Okay. Now, look at that. The benefits starting now. We all don't have to be this guy. Maybe none of you do. Maybe there's a handful of you. This guy is powerlifting, he's back squatting a good amount of weight. But it's really important to know it's never too late to start. whether you've been exercising your entire life and then you had to stop maybe for a procedure or maybe you got off track, or if you've never exercised before, don't get caught up with that. You can always benefit from exercise. Maybe you're not going to hit your genetic potential, whatever arbitrary mark that is. And most people really don't, and even at the elite side of sport. So it's not about that. The benefits of exercise can happen at any point. It's all just about maintaining that level of activity throughout a lifespan. And now, again, age is not the determinant of this. It's the amount of activity that you're doing. And then the study from Cunningham et al., this was a big study. He observed 24 meta-analyses and systematic reviews. So essentially, this was a review of reviews. And what was looking at was active versus inactive adults and older adults specifically. So again, not looking at young versus old. This is active versus inactive. We saw the active adults had better aerobic fitness. Those gas tanks were larger. You had a decrease in all-cause mortality, and that's just your chances or risk of dying of any reason, but specifically in this case, cancer, heart disease, things of that nature. You saw a decreased risk of fall and loss of mobility. You're able to move your body through space, coordinate movement, stay upright, and not go to the ground unless you want to. These people lived longer, they had suffered less depression, and their brains were functioning at a higher level. So again, focus on where you are right now. Again, if you've never exercised before, don't worry about that. Get started, be consistent. Hopefully by the end of this presentation, you'll have a good idea of where to get started. And obviously, there can be follow-up questions as we move on here. But for now, focus on where you are. The benefits are present to you just at any time. Now, we talk about risk modification, and this first point I'm going to bring up is probably going to be pretty obvious to most of you. We need to get moving because first off, when we look at smoking versus non-smokers, you have approximately 70 to 80% higher rate of all-cause mortality if you smoke. Again, pretty self-explanatory. I don't really need to defend that point that much. However, when you compare populations of people that take 6,000 to 16,000 steps per day, you see a 126% higher rate of all-cause mortality. That is demonstrating, again, this is just demonstrating a relationship. This is not causal, meaning if you go from 6 to 16,000, you will get exactly that. But this association of being more active actually decreased your risk of all-cause mortality more so than your smoking status. And where this came from, Stronger by Science does these reviews. They largely work in the sports science realm, but they will go into health, longevity type research. But this study from Jaedi et al. Was looking at different cohorts and different populations of activity. And we see here that bigger bubble where my marker is about with that 6,000 step marker. We go all the way down here to that 16,000. We see that decrease or that decreasing hazard ratio, which is just the percent of how much it's going to affect your all-cause mortality, the risk of dying of whatever kind of disease is present. This isn't to say that you have to get to 16,000 steps to be healthy. It's important. Notice the direction this line is trending. Okay, it's trending down the more active you are. Meaning, if you're only taking 3,000 or 4,000 steps, try to make it a goal to get to 7,500. Once you can hold 7,500 steps, try to go a little bit further and just slowly make yourself more active to make sure you're actually fully benefiting from the activity and all those benefits of exercise. Okay, now, moving on here, going on to the physiology of exercise, I'm going to start by talking about the cardiovascular system. Breaking this up, we're going to start with how the heart is affected, and some of these points are a little redundant and connected to each other. But first, we see an increase of cardiac output. What cardiac output is how much blood your heart can circulate in a minute's time, so your stroke volume times your heart rate. We see the output increasing, and it's going to be related to a decreased resting rate, because the higher the stroke volume, the stronger your heart is, the more blood it can circulate per beat, meaning to pump the same amount of blood at rest, it doesn't have to beat as frequently. And the same thing as you're moving up with exercise, you'll find that relatively your heart doesn't have to work as hard to maintain different levels of exertion. You have the ability of the heart to contract and relax more rapidly to meet those demands of exercise or when you're at rest. And you're getting blood to the organs that it needs to go to, getting the oxygen to where it needs to go to. You also see positive changes in cardiac growth and size. Your heart is a muscle. You want to train it like a muscle. And the stronger we can get it, those bigger muscles, the more blood it can pump per beat. Now here, when we're looking at blood vessels and how they're changed with consistent exercise, very similar to the heart, these vessels gain the ability to relax and dilate more readily, they're more pliable essentially. And that's going to affect the overall or decrease the vascular resistance. So you're training, you're exercising consistently, the vessels are getting stretched up, they're becoming more compliant to the demands of exercise. So they can open up quicker, but they can also contract a little bit faster to make sure we're controlling blood pressure. The decrease of vascular resistance will decrease blood pressure over time and also decrease the formation of plaque, the atherosclerotic plaque, and its ability to break off and actually form clots. We're talking about the blood and how it changes. You become more insulin dependent or sensitive, and you can actually use that insulin to get the glucose to where it needs to go, which overall is improving the glucose control. You can improve the oxygen carrying capacity, and how this is done is through hemoglobin. Hemoglobin is this molecule where it's 4 iron molecules paired with this globule, this big protein that binds it all together. And iron does a great job of binding to oxygen. And what it does, it can carry oxygen through the blood, and say when it needs to get to the muscle where there's myoglobin. Myoglobin can then take the oxygen from the hemoglobin and use it for oxidative phosphorylation, essentially using it to produce energy. You also see positive effects of increasing your high density lipoproteins and decreasing your LDL and your triglycerides. All of these things together are going to collectively reduce your risk factors for cardiovascular disease and overall improve your health and reduce your risk of cardiovascular disease. Okay, now here, the musculoskeletal system. Again, just like that guy squatting, we don't have to do this. If you want to, great. But this is a great way to apply tension to the body, to build muscle, to make sure the bones are staying strong. But how exercise affects the muscle, you're stimulating it. And a big part of it that I kind of talked about before, you become more glucose sensitive. Your muscle has an ability to actually take glucose in. You have these GLUT4 transporters that can go to the cell wall of these muscles. And when they need glucose, they translocate or move to where they are to be able to pull glucose in to utilize it as energy. So that's a very important factor of maintaining muscle mass. Second, force production. We talked about that with strength. Your ability to produce force is your ability to move an object through space, your body to stop yourself. Say if you fall, you can reach yourself out and stop. And it's really important because it's increasing the ease of which you do your activities of daily living. You're carrying shopping bags. I'm a gardener, so you think about moving pots or bags of dirt around. Making sure you maintain muscle mass is going to allow you to do these activities for longer periods of time. Additionally, we talk about even stability, you're decreasing your likeliness of fall, but also your fall recovery. So say you do get to the ground, you have a good amount of muscle mass, you tripped over something, you're able to get yourself back up to your feet and into a safe position. And it's why, again, it's really important to maintain muscle mass throughout a lifespan and prioritize it with your training as you age. And finally, you're increasing your mitochondrial efficiency, and the mitochondria are incredibly important in taking that oxygen, taking the different fats, and utilizing them in beta oxidation to support aerobic type activity. Now, maintaining bone in a very similar way we talk about maintaining muscles, we don't want to become frail. We don't want our bones to become weak, our connective tissue to become weak. It's the structure in which supports us. So if the structure begins to weaken, everything around us begins to weaken. And we want to be stable in the same way. We want to have strong muscles, coordinated muscles to make sure we're doing the things that we want our body to do. But having that strong structure is going to make us more stable on our feet and, again, preventing that frailty. So there's 3 main drivers of hypertrophy, and hypertrophy is building muscle. Tension seems to be the most important. It's the only one I'm really going to touch on now. And again, it's not really important to get into the nitty gritty of all of that. But essentially, tension can be applied by putting force on a muscle. How do you apply force on a muscle? You can do external loading, just like this lady's doing right here, holding that weight. All of the muscles supporting the weight are under tension. However, it doesn't have to be like this. It can be a body weight type movement. It can be resistance bands. It can be yoga. It can be all different types of movements. As long as we're stretching those muscles and making them work and you're feeling those muscles work, they're most likely under tension. The more tension you're stimulated with, I've lifted weights a long time. To produce enough tension to provide an adequate stimulus, I need to add a little bit of weight over time, make the training a little more challenging, but the same thing can be applied to body weight, to banded type exercises. It's just important to make sure you are applying tension to your body and making sure the bone and muscle mass are stimulated to maintain size, or if anything, maybe get a little bit of growth. Now, a challenge to you that I want to, everybody to work on is find your centenarian decathlon. And essentially what this is you want to find those activities you want to be doing in the last decade of your life. And that is a little bit of a morbid practice, I know, but it's important because we don't want to get to the point, and you're never going to know when you're going to be in the last decade of your life, but you want to make sure you're doing the things you want to be doing as long as you possibly can do them, whether it's going on a specific hike, it's maintaining independence around your home, anything in between. And this idea comes from Peter Attia, wrote a book called Outlive. I know he's going to do a much better job addressing this, but I think this is good practice for everybody to consider, because if you want to be doing these things later in life, you want to make sure you're training your body to be prepared to do those things later on. And, yes, strength will decrease with age. Your overall fitness will. That's just a normal part of the aging process. However, we can keep you as fit as possible, as strong as possible by having a good training program that is specifically laid out to achieve the activities you want to be doing. Okay. So now going into metabolism, we had a great presentation 2 weeks ago. Beth Gonzalez went all over nutrition. So I'm not even, this by no means, I can't hold a candle to her. So I'm just going to touch on this very briefly. We want to focus on here, in the study from Thifault and Bergeron, they looked at the effects of exercise on your overall metabolic health. And again, I apologize if any of this text is too small. I will be going over it on this side here. A big part of what their study found and what they observed, that consistent exercise is related to a 30% reduction of risk of type 2 diabetes. This is incredibly important and very much related to all of these different systems and these different organs working more efficiently. What we see with the liver and how that changes, you're able to use glycogen, your stored form of glucose, more effectively. And because you're able to use those glycogen stores, the liver can take in the glucose that's circulating and recycle it in this process. We see here, you're decreasing the overall glucose production because it doesn't need to be used systemically, and you can also get into those fat stores more effectively. We see right here, this is adipose tissue getting into those triglycerides, and triglyceride is just a stored form of fat. I'm actually going to move on here, show this. You're able to mobilize these stored forms of fatty acids and use them in beta oxidation, which is, again, just utilizing fat as a source of energy instead of having to rely on high levels of glucose circulating constantly. Also with the pancreas, it's very important here because you're improving your overall insulin sensitivity, meaning the pancreas, doesn't have to work as hard through those beta cells to produce more and more and more insulin because you're becoming less and less responsive. So again, here, all of these organs are playing a large role. We did already talk about the heart and the muscle and the blood vessels in their role in this. But again, having consistent exercise can help regulate metabolic health tremendously in concert with having an adequate diet that's meeting all of those basic requirements to maintain health. Now, going into cognitive function and how this is affected with exercise, we see here in this nice little flow chart, if you're active, ultimately it's going to improve your cognitive performance. This is shown very strongly in many different studies. But we see physical exercise, sports, performance art, whatever it may be, just being physically active affects your brain's hardware and the brain's software. When we think about hardware, it's the metabolic demands of exercise. And very much in the same way as the cardiovascular system with the arteries throughout the body, the arteries in your brain become more pliable, be able to, work with that increased blood flow with activity, and also improving utilizing those neurotropic factors to improve the overall hardware and structure of your brain. We also focused on here, and this is a really important part and maybe something that's overlooked. When you're exercising, if it's a new movement or you're increasing the load, meaning like the weight that you're doing, or you're challenging yourself in new ways, your body is learning. I know we don't always think about it, and the gym culture does very much have a meathead type culture where it's not a lot of thought going into it, but you are stimulating your brain to maintain its plasticity or its ability to adapt and learn. And exercise is one source of this. Performance arts, you're thinking about dance, you're thinking about memorizing a routine, coordinating your body through space. That's improving the overall software of your brain. And that's going to be also connected to the personal affect and the motivation you feel to exercise, because you feel yourself getting better. You're improving. You actually noticing your movement ability, your coordination. And again, overall, the improvements of the software and the hardware, improving your overall health of your brain and the overall cognitive performance. Now, the fit principle. This is how we actually can apply exercise. So this is the first part is kind of introducing the understanding of what exercise does. Now, this is how we exercise. I want to start here by talking about the F, frequency. This is the amount of sessions you do in a given time. This could be some cases daily. Generally, it's going to be in a weekly type period, but maybe if your schedule is really irregular, you travel a lot, or just, you don't really know what your week is going to look like on a given basis, it's how frequently you're training in any one of these amount of times. The I relates to intensity, and this is simply how hard is the exercise that you're doing. This could be, are you hiking up the steepest hill? Are you going on just a walk around the neighborhood? That's how it relates back to the intensity of the exercise. And T, the time is how long is that given session? And we'll go about, balancing these out later on. So I will give a little bit more information. The T is type. This is what are you doing? It's not so much separating strength and cardio, aerobic, anaerobic, but are you, again, going on a walk? Are you lifting weights? Are you using a kettlebell, a dumbbell? Are you doing yoga? That's kind of where we get more into the type of exercise. And that's very much going to be a personal decision with you and finding out what you enjoy and how to apply that to your life to be as consistent as possible. Okay. So now balancing the fit, and I want to focus on those first three, the frequency, intensity, and the time. What we see here, this is a workout recovery cycle, also known as the SRA curve, the stimulus recovery adaptation curve. We want to see here the training stimulus. This is you start an exercise session, whatever it is. Depending on what you choose, it's going to generate a certain amount of fatigue. You're going to feel tired. The harder that session is, or maybe if it's new to you, brand new type of movement, it's going to generate a certain amount of fatigue. Now, you alleviate the stimulus. You're now in the recovery aspect of this cycle. Hopefully, if the stimulus was adequate enough at the start, you will actually super compensate or be a little bit better, a little fitter, a little stronger, whatever it may be, than you were before. Now, we see the involution part. This is, say you just did one session and you got busy and it's been 2 weeks. Yeah, there's probably a good chance you return back to baseline. Just that one stimulus in and of itself isn't enough to just hold that forever. You have to find that right balance of when am I going to do my next training session? And that's really where the art of this is. That's where there isn't really going to be a perfect answer. I'm going to go over that a little bit more in the next slide of how we can kind of tailor that to you and your schedule and how you adapt to training. But what I want to show you on this right side, and this is where I can really, nerd out, geek out about the intricacies of periodization. I showed you that chart at the very beginning of my annual training plan, and these were all things that I considered of what kind of periodization or how am I going to progress an athlete, or in this case, a cardiac rehab patient, through their time in our program. The linear periodization is a very simplistic way of demonstrating that when you're doing a lot of training initially, as you start to want to increase the intensity or how hard you're working, you have to start pulling back on those other levers where the training sessions get harder. They're going to have to become shorter or less frequent. You want to think about an athlete going into season. Right before season, we don't want the hardest train to be because they're practicing a lot and they have just a lot of other things going on that we don't want to be tiring them out in the training aspect. What makes more sense when we're thinking about somebody just in the general fitness, cardiac rehab type environment, this undulating periodization just shows that push and pull and how it can be very fluid. And you're just knowing where maybe I want to exercise 7 days this week. Like, all right, those sessions are going to have to be a little lower in volume because the frequency is going up, or they're going to be a little bit more challenging of sessions. But this is going to be able to fit your life. And, sometimes you might only be able to get 2 or 3 sessions in a week. It's understanding how to push and pull those levers to make sure we're not pushing ourselves to a point of overtraining and really listening to our bodies. And that's where this next slide really comes into play. How much should you do? Along with, how much should I be doing of like time-wise or how many sessions a week? This is how much within a given session and also within maybe a given week of training. And you need to learn these questions. These are 2 vital questions in learning how to answer that first question. First, am I recovering within 24 to 48 hours? You do a session, a day or 2 later, it's like, yeah, I'm feeling pretty good. Or no, like I can't get out of bed still. I'm feeling beat up and run down. And the second question is, am I improving or maintaining? And it's improving or maintaining because we don't always have to seek to continue getting better. You might be happy with a certain level of wellness or fitness that you've established, and you're just trying to keep there because you're happy with that. But this is, yeah, maybe I'm not really feeling like I'm getting the output that I want to in the gym, or my hikes are feeling a little too hard, my walks are feeling a little too challenging, kind of what's going on. And realistically, if you're answering no to either of these, you're probably doing a little too much. And a way we can kind of think about this conceptually is this curve right here, this nice bell curve. And on this side, we see the minimal effective dose. And on this side, we see our maximal recoverable volume. And these 2 points are arbitrary. It's going to change with your training status. It's going to change person to person. But this is how you can use these questions on this side to answer, am I doing enough or am I doing too much? Frankly, if you can answer yes to both of these questions, again, we're not trying to chase optimal. We're not trying to chase perfect. That's not really the point of all of this. If you are recovering in an adequate amount of time, that you're not feeling like your performance is affected session to session, and you're either improving or maintaining your performance, stay the course. Once one of these questions become no, then you can start making a modification. If you start noticing that I'm kind of feeling a little beat up, you're probably finding that maximal recoverable volume side. You just pull back a little bit, you assess, and you make changes. And also on the same side, I'm not really improving in the way I want to, or maybe my performance is diminishing. Maybe you can do a little bit more and just try that out. But again, you're your own case study in this. And as much as I'd love to give you all specific examples of how many sets, how many sessions, how many reps of every exercise, we try to do our best job in the rehab setting and the sports setting to answer these questions. But this is something you're going to have to kind of find out for yourself. And frankly, it's where the kind of the fun of this is when you find a program for yourself that you're enjoying, that you can be consistent with. And then from there, you just push and pull those levers of the frequency, intensity, and the overall time you spend training. So now we talk about the type of training, and I want to differentiate here what strength training and cardio training is. Starting off on strength, inherently strength type exercises, we're using higher forces or load, so holding weights or things like that, banded type exercises. And these are going to be intermittent bouts. It might be a few seconds, 30 seconds up to a minute, but you're going to be working for a period of time and allowing your muscles to rest. Yeah, we're going to get some cardiovascular stimulus. We're going to see positive blood pressure responses with this type of exercise, but it's not the priority. The priority of this is to build muscle mass and maintain or even increase a little bit of bone mass so we can improve or ease those activities of daily living. So you think about working those muscles, you're doing a squat, a push-up. If you want to think of any of those kind of typical strength type exercises, you're feeling the fatigue in the muscles that are working, not in the breath, not in the heart rate, because we want to try to stimulate those muscles to be stronger, to maintain their size. And again, examples of this, lifting weights, using resistance bands, different type of isometric exercise. When you think about isometrics, it could be a plank, it could be yoga, different forms of Pilates. There's a lot of different variety in what could be strength training. So don't think, it has to be a barbell with weights, anything like that. And those of you that have been in the rehab program with me, we do it all different ways, trying to build you from the ground up and make the program fit you the best we can. Now, we look at cardiovascular type training. The main difference is this type of training is usually going to be continuous. Yes, there are types of interval programs you can use, but generally you're going to be active for continuous bouts of exercise, whether that be several minutes, 10 minutes at a time, up to half an hour, hour. Some people can be going hours at a time. The benefit of this is the heart rate stays elevated for long periods of time, and you see a lot of those very good cardiovascular benefits that I talked about in that initial slide. You're going to have minimal or no rest, kind of getting back to that point of continuous movement. The intensity of this is going to be a little bit lower. And the reason why it needs to be lower is if we start having local muscle fatigue, say in your legs and you're on a hike, if your legs are what fatigues you and makes you stop, but you feel like your heart rate isn't beating hard enough, you're probably trending more towards a strengthening type exercise. So make sure that the exercise you choose is a low enough intensity that you can maintain a higher heart rate for a continuous amount of time, a longer type of duration. We want to do this to improve your aerobic function, build that gas tank I've talked about before, and increase your overall fitness. Examples of this, walking, cycling, doing different types of interval training, rowing. It can really be anything. And you can even kind of pair strength movements, strength type movements, and build out a great cardio benefit by having that continuous movement where maybe you're doing a set of squats followed by a core exercise, followed by maybe you walk on the treadmill for a few minutes. It doesn't have to be all one way. And really, that's again where the fun kind of comes into this of finding the type of training that you want to do to fit your needs, but also fit what you enjoy. And now here on this side, we talk about this continuum, again, anaerobic fitness and aerobic fitness. And these are two extreme sides where we think about marathoners, triathletes on that aerobic side, where they're continuously moving for hours and hours on end. On the other side, we want to think about a power lifter, an Olympic weightlifter. And here it says NFL lineman. You're working for a few seconds at a time, moving as fast as you can. Ideally, with most of your training, you're going to, again, want to find yourself somewhere in the middle, unless you have a specific reason to prioritize your aerobic health or your anaerobic health, where you're trying to build maybe a little more strength and power, or you're trying to build that gas tank a little bit more. Again, you kind of want to find what are your priorities. That centenarian decathlon, think about that in your head. What are those activities you want to be doing? And how can you build a training program to best fit that? Okay. Now, combining these two, this next slide is going to get into this a little bit. And don't let this slide overwhelm you. Essentially, what this is a Monday through Sunday calendar showing you how you can structure 3 days a week of training. We see here, this is set up in a Monday, Wednesday, Friday approach. It doesn't have to be that. It could be Monday, Tuesday, Saturday, Monday, Wednesday, Thursday. Again, you're just collecting 3 days of training in a 7-day period. What I want you to do here, looking at this Monday session, the cardio, this whatever exercise you choose, going about 45 minutes to an hour. Additionally, you have a strength session. You're doing 3 to 5 rounds. Don't worry about what all these exercises are. I'm more than happy to share resources at a future date to kind of explain this a little bit better. Again, this is something that we could take hours discussing, but just for the sake of kind of demonstrating how to adjust your training, because we're training 3 days a week, these individual sessions can be a little bit longer. We're giving ourselves 48 hours on these off days. They don't have to be inactive. You don't have to be resting in bed waiting for that next training session. Go out on a walk, enjoy time with friends and family, do stuff outside, cook a meal, just enjoy your life on these days and make that the priority when you're not actively training. Okay. So now when we compare this schedule to what we're going to see next, this is a 5-day a week program. What I want you to first notice, and again, this is Monday through Friday in this, the cardio sessions go from 45 minutes to 60 minutes to down to 15 to 30 minutes. Why? Because we're pushing and pulling those levers that I talked about in that slide. We're training more frequently. That means the overall time of these sessions can reduce. Okay. We don't want to keep the sessions as long and make these big jumps in volume. Some days you might only have 3 days, so you have to kind of follow a template more like the one I just showed. And other days you might have more availability. You want to be active a little bit longer. And also the same here is applied to the strength training. Instead of 3 to 5 rounds, because we're training 5 days a week, we only need to do 1 to 3 rounds of these different exercises. All the movements are very similar. And yes, they kind of undulate day to day of what those movements are. But I really want you to take away from these. First off, balancing that fit, the first 3 of knowing if you're going to be training more often, the sessions don't have to be as long, but also make the schedule fit what you're doing. Make it fit your life. If you're traveling and you know you're going to be gone for a few days, don't force in a bunch of training days where they won't fit. And if you're busy with work, the same thing applies. It's okay to go from 3 days a week, 1 week to the next week going 5, 4 days. There is no right answer. Again, I don't want you to get overwhelmed with all of this. We're trying to meet those minimum amounts of the 150 minutes of aerobic exercise, at least 2 strength training sessions. If we're starting there and you're doing something you enjoy, you're getting a lot of that benefit. If you can go beyond there, great, do so. Again, no one right way to do this. You also don't have to do your cardio and strength on the same days. You can have 5 days of cardio, 2 days of strength. Again, I can give endless examples of this, so I'm going to kind of stop where I'm at right now. But again, there's flexibility to this. Make it fit you and what you want to do. Now, again, another slide to not get overwhelmed by. This is a similar template that I've given to rehab patients in the past. This is day 1 of training. So again, we're imagining day 1 being Monday. This is your Wednesday strength. This is your Friday strength session. What I really want you to focus on and the takeaway from this slide to be is this is a week 1 of training. This is the second week of training. This is the third week. Over time, we want to slowly increase that volume, and we're imagining that minimal effective dose, the maximal recoverable volume. We're steadily trying to increase the volume and the workload over time and making sure we can recover. So just focusing on this first day right here, this is Monday's lift. You come around, say it's not a real day. March 1st is the first day, first Monday of the month. You're doing your body weight squats. You're doing 2 sets of 5 to 10 repetitions. So overall in the session, you're going to do 10 to 20 squats in total. All these other exercises, again, don't worry about what they are. But when you come back to week 2, that range is increased a little bit. You still have the flexibility. So say that first session, you did 2 sets of 5 squats, meaning you did 5 squats, you rested, you did 5 more. Well, if you felt really good, you had the opportunity, well, maybe you try 10, maybe you go all the way up to 15, but let's say the second week you do 15 squats and you're just wiped out, you're sore. When you come back here, yeah, you have the option to do 3 sets. We're steadily trying to increase the volume, and that's something, a priority of the overload principle, is trying to do a little bit more, whether it's your cardiovascular training, whether you're doing your strength training, you're trying to find where you fall in that minimal effective dose, maximal recoverable volume. Again, I'm more than happy to share more details on how to build out a specific program. There's not enough time right now for me to go over this, but again, the general takeaway, trying to find out, you're your own case study. How much can you recover from, and how can you adapt your training to what you want to achieve? Now, oh, there we go. Sorry about that. Changing gears a little bit here. Talk about motivation and community and how we can actually work on making exercise something that's a part of our lives, not just something that we feel like we have to do, and how to get people around us that can support us. And I really enjoy the self-determination theory as a way to talk about motivation and really driving intrinsic motivation and overall well-being. It's built on these 3 basic needs that we need to fulfill. The first being competence, and that's the sense that you can do something, that you can accomplish the task that you're setting out to do. Autonomy is you feel like you have control over the environment. You're not being told, you're not being managed. You're able to control the time you exercise, what type of that you're doing, and all of that. The big one for community is going to be relatedness. It's having people around you. Maybe they're not directly, in person with you, but you have people you can reach out to, people, a network of support that can bring you along. It's important to note that we need all 3 of these fulfilled. It doesn't have to be done tomorrow, but the ultimate goal with what you choose to do with exercise is find a way all 3 of these can be fulfilled. It's going to improve your motivation and your overall engagement in the activity, and you're going to perform better. You're going to feel better. And we talk about community, start close to home. Maybe you have people in the house with you. You want to ask, you have kids, a partner, whoever it may be, like, hey, I want to start doing this. I'd love it if you did it with me. But also it doesn't have to be in the home. It can be friends. It can be people in the community. That's where, gyms can be a positive experience for people because it puts you around people that are doing the same thing and help build that sense of community from there. And again, that goes into finding your ideal environment. Maybe you've been to a gym before. Maybe that's just not a place you enjoy being. We don't need to force it, okay? Make that environment the one that you want to be that's best for you. And prioritize that community. And this really relates to the blue zones. And there's a documentary that's come out recently on Netflix. There's a book. But the commonality among all of these populations of centenarians was they had a strong community presence. And again, it could be family, friends, whatever that community is. This should be a priority to make sure you're engaged in what you're doing for as long as you can. Okay, now another kind of change here. We're going to go over how we at Marin Health manage our cardiac rehab program and exercise to our patients. At the top of this, we see Sarah Lamb on the side. She is our clinical director. She is on that administrative side, controlling what we do. She's given us the green light. She's been a great advocate for what we do in cardiac rehab. On the other side, the medical side, Dr. Ben Ancock, Dr. Arvind Nishtala, they're our co-medical directors, and they oversee what we do, again, as it relates to medicine and how we manage the patients when different things come up. Next, maybe most importantly, I might be biased, but Max Drake, he's our cardiac rehab and wellness supervisor. He's the reason why we're all doing this here today in this wellness lecture series. So he's my mentor. He's been tremendously valuable to me as I've transitioned from strength and conditioning into this health field. And now the operators. You see me down here, also another EP, Megan Arauzo. When you come into one of our programs, we're the ones that are going to greet you and build out that exercise program. Additionally, Claire Costello, she's an intricate part of our program and has been for a long time, working with that Ornish program as our group support leader, but she's also a tremendous resource for any sort of psychological resources we may need. Nancy LaFranchi here, our fitness leader, our onboarding specialist. She's done an outstanding job. I hope I'm not wrong, but I believe she's been with us for 13 years, and she's a staple. She does such an outstanding job bringing people into the program, working on, insurance clearances, all of that stuff. Again, can't say how valuable she is. And also on the other side, our bookend presenters for me, Pravina will be presenting in 2 weeks on stress management, but she's one of our registered dietitians that works primarily with our phase 2 patients. And Beth Gonzalez, who gave the presentation 2 weeks prior to me, is our registered dietitian for our Ornish program. And again, they're incredibly valuable to what we do in making this a holistic program. Now, the programs that we have, our phase 2 program, this is traditional cardiac rehab. This is a 36 session program over 12 weeks. And we're focusing primarily on cardiovascular type exercise. There is strength on an individual basis. We're taking EKGs constantly. We're checking heart rates, blood pressures, workloads. And a big part of this, the program is covered by insurance. You must have a qualifying diagnosis. But in concert with this, we have our intensive cardiac rehab program. This is the Ornish program. This is an 18 session over 9-week program. This is integrating a lot of these different types or pillars of exercise in health, where we're focusing on an hour of exercise, an hour of stress management. We have an hour lecture in the evening, followed by an hour of group support. We're focusing on all of these different things to get the best experience we can, where, again, the traditional rehab is focused exclusively on exercise. This is focusing on a lot of the different health aspects to make ourselves as healthy as possible. And it is a mix of strength and cardio exercise for the entire group. And finally, one program we hope to get started very soon, phase 3. I like to call this our advanced cardiac rehab program. This is for someone who maybe doesn't have a qualifying diagnosis, or maybe they're a graduate of our phase 2, our Ornish program. They still want supervision, they still want guidance. So we want to be able to offer this program to that population. Eventually, we want to make it to move into the preventative side and have a model for bookending, pre-cardiac event, hopefully avoiding cardiac event, but also continuing a training plan for the course of people's lives so they feel strong and confident. And I'm going to actually leave it here. I see my time is coming down. As Burr said, we have tip-off coming for the Warriors game. So I want to start by saying thank you all very much for being here. I'm sorry I don't have any time to answer questions. I don't want to push past that 7 o'clock time. So I will be getting back to you all and all the questions listed in the chat. Begin. Thank you all very much for your time. I hope you have a nice rest of your evening. Have a good night.